You caught us talking a little bit tonight, and welcome to our community town hall. Thank you for joining us. We are all excited to get started with our town hall this evening, as you can tell with our excitement behind the scenes. Mary Washington Healthcare is committed to improving the health of the people in our community, and we take this commitment seriously and know that you have many questions about what's happening here, especially with vaccines. So we know that's coming. Tonight, we are here to share what we know about what's happening in our community with the data around COVID-19 and how to keep you and your family healthy and safe. So tonight, you're going to hear from our panel. I'd like to welcome first Dr. Mike McDermott, our Chief Executive Officer for Mary Washington Healthcare. I'd like to also welcome Eileen Doman, our Chief Nursing Officer for Mary Washington Healthcare. And last but not least, Dr. Christopher Newman, who is our Chief Medical Officer and Chief Operating Officer. So Dr. McDermott, I'd like to start with you. Let's start with what's happening here in our community.
Great. Thank you. And thank you for everybody taking a little bit of time out of your evening again to tune into our community town halls. There's a lot going on and things are changing very, very rapidly regarding the coronavirus and the pandemic. Obviously, there's our issue with the prevalence of COVID-19 in our community happening, the pressures it's putting on with patients that require hospitalization. And at the same time, there's that light at the end of the tunnel hope that we have with the vaccine rolling out and starting to become available for those population groups that have been designated to be high priority. And so all of those things are happening at once, and we're playing a role here in our community to make sure that we build the infrastructure that's necessary to make sure that our community can get immunized and be as safe as they can be as quickly as possible. I want to talk a little bit first about the burden that patients having COVID-19 are placing on our healthcare system. And the disease is still very, very prevalent in our community. We currently have 88 patients who are hospitalized between Mary Washington Hospital and Stafford Hospital that need to be in the hospital to help them battle COVID-19. That's a very high number. We've been up in the 80s and 90s for most of the last week and a half. You can see the curve there on the right. The yellow line is our number of patients hospitalized on any day, and from November 1st until now, that trend line is still on a very steep upward trend. At the state level, that's the orange line, the number of patients hospitalized in the state, another new record set today, over 2,800, I believe, individuals hospitalized in the Commonwealth of Virginia, a new record. And so that prevalence of COVID-19 in the state and in our community remains very, very high. The prevalence in our community is also very high. And we need to continue to take the steps that we know we can do as a community to help mitigate that, which is stay at home if at all possible. Don't go into other environments with other individuals. Wear a mask at all times if it is essential that you are outside of your household. Social distance, all those things we know that can lower the transmissibility of COVID-19 and therefore lower the prevalence of coronavirus in our community and relieve some of this pressure that we're having as a health system. On the vaccine front, I'm so proud of our team and all the work they put in place to really put plans in place to be able to vaccinate our community as rapidly as possible. Things are changing very, very rapidly here. Just today, earlier, a few hours ago, the governor announced at his press conference that he is expanding the 1B group, the 1B priority groups. I don't know if we're able to bring up a slide that outlines that and describes those groups based on the governor's new recommendation. The phase 1B is now individuals 65 and older in our community, a grouping of frontline essential workers that includes the groups over to the right, and then also individuals age 16 to 64 who have high-risk medical conditions as defined by the CDC. We're very excited about the expansion of these priority groups, and I'm glad that the governor did this. This will allow us to get the vaccine into individuals who are at very high risk for having bad outcomes if they acquire COVID-19. This news is simply hours old, right? And so we are just responding to this news. But we have plans here in our community to make sure our vaccine clinic here, we are addressing these populations. So if you're in one of those priority groups, our plan is to have an update on our website on mwhc.com tomorrow at 3 p.m. We'll have an update to our community as to where we stand regarding rolling out availability of appointments for our community if you're in one of those high priority groups. We have been all of our associates that are part of our Mary Washington healthcare team, as well as most of those individuals in our community that were in the 1A group, the healthcare practitioners. We are reaching out to those groups in coordination with our Rappahannock Area Health District to contact those individuals and make sure they have the ability to get vaccinated. But we're going to be rolling into 1B as quickly as possible, hopefully as soon as this weekend would be my hope. But we will post an update on our website, mwhc.com, tomorrow at 3 p.m. To inform our community about how they get a vaccine if they're in one of those high priority groups now, and the expansion of the 1B group that the governor announced this afternoon. That is very exciting. One thing I do want to say, as more and more individuals get vaccinated, just want to reiterate that this is a 2-dose vaccine. And there's some individuals, I think, who think, oh, I got the shot, I'm good. I can no longer get COVID-19. And that's not how receiving the vaccine works. It's not how your body builds up immunity. So when you receive the first shot, it primes your body and starts to initiate the immune response. When you get your second shot, it really kicks it into place. And for both of these vaccines, the advice is that your maximum immunity that your body is going to produce is somewhat about a week after your second dose. So if you receive the vaccine, you can catch coronavirus a week later or 2 weeks later. That would not be unusual because your body has not had the time to mount the complete immune response. So I think it's important for all of us listening today, you can help get that message out too. Like, hey, when you get your first shot, it doesn't mean you have a shield and you're invincible in any way, shape, or form. It's a 2-dose vaccine, and your maximum immunity happens sometime after your second dose. So there is still a window, and the dose is the vaccine is 95% effective. So that's a great vaccine effectiveness. But remember, that means 1 in 20 individuals will not mount an immune response that prevents them from catching coronavirus. So even if you receive the vaccine, it doesn't mean you're invincible. We all still need to be responsible, take those actions, keep wearing masks, stay inside, follow all the same protocols. It doesn't mean you have a ticket to ride and you can do whatever you want to in our society with the prevalence of coronavirus being as high as it is. And so those are my opening comments tonight.
Thank you, Dr. McDermott. I'd like to transition to Dr. Newman. Can you talk to us a little bit about more of the operations behind the vaccines and how things are working right now?
Yeah, it has been an operation, and I am so proud of the team, our community, partnership with the Department of Health, and how rapidly we were able to stand this up. Just a few weeks ago, we felt we were only going to get a couple thousand vaccines in order to really just vaccinate frontline hospital-based workers. So we did not have the opportunity to really plan or understand what we're going to be doing. And even though we weren't tasked with vaccinating our community, we understood that that's our mission. It's hard for me to think of anything more important right now for our community and for the health of our community than vaccinating everyone. So, you know, it's a very difficult operation to set up. I was just so proud last night when I got to go to the vaccine clinic and see everybody in action. We had so many volunteers from the organization, volunteers for the community. We were vaccinating hundreds of people an hour. It was just flowing through, and you know, we've all been through a very difficult year, both with the pandemic as well as a lot of other unrest in our country. And it just made me a little emotional to see the positive side of this and seeing how excited everybody was to get that vaccine, how grateful, how hard the team was working to get the vaccine deployed. So, you know, things are going to keep changing. We just found out a couple hours ago that, you know, it's a much broader group that we're going to be, you know, getting out to. We do know the governor did tell us today that the state of Virginia is expecting roughly 110,000 doses a week for the whole state. We are going to really work to get as many of those doses here in our Fredericksburg community. And, you know, we're committed to 1,000 to 2,000 vaccines a day through our clinic to our community. And I'm very glad that the governor made the decision to move to this broader group. Up to this date, we've had, and rightfully so, a lot of people are wondering, why did this person get it before me? I should get it before. And, all those feelings are understandable. Many people have been almost prisoners in their home, that have high risk categories. And this has been a long haul for many individuals. And I'm glad that this is now going to be opened up to a broader group. And we are committed to do whatever it takes to really be able to vaccinate our community as quickly as possible.
Excellent. Thank you, Dr. Newman. Eileen, opening remarks for you this evening.
I guess I just want to remind or build a little bit upon what Mike said is, meanwhile, back at the rest of the health system, we're taking care of 80 to 90 COVID positive patients every day. And that is pushing us, and no different than it has been over the last several weeks. We've got 3 dedicated COVID units at Mary Washington, 1 at Stafford, in addition to our ICUs. Staff are working very hard. They are extremely busy. They are tired. They want you to get the vaccine because we all want this to be over. And so this is that great ray of hope of getting to the point where a much broader part of our population can be vaccinated. But I want to thank all of our associates that are doing such an incredible job of continuing to care for our community. I also want to thank many of our community partners who have made donations to the hospitals. We've got lunches and dinners coming in every day to our COVID units, and everyone is very grateful for that. I also want to make sure that everyone knows that it's not just our clinical staff at the hospital that is helping to take care of, help us do what we do, taking care of our community. It's everybody. And so we've issued an internal hands-on deck, which means that we have people from our business offices helping to answer phones on our inpatient units. We have people from our IS team up at the vaccine clinic. I mean, this is truly an all hands on deck. Everyone in our organization is focused on either helping us care for patients that have COVID or helping us get vaccine into people's arms so that we don't see them as patients with COVID. So very, very busy and things changing in the moment and keeping focus.
Thank you, Eileen. We're going to go ahead and get started right away on the community questions. They're coming in fast and furious.
Yeah.
And a lot of them are about the specifics. How do I schedule a vaccine, or what do I need to bring to prove I am in a group? So can we talk about first how do I prove I'm in a group? What do I bring with me once I do have an appointment?
Well, the age part is easy, right? Proof of age. If you're in 65 or older, you have your driver's license and identification that helps prove that. And so you'll be able to register, and then you'll have to show that the age when you come in for your appointment. If you're an individual with a high-risk medical condition, we'll probably require a note from your physician documenting the medical condition and the reason why you should receive the vaccine at this point in time. We are working with, as far as the other priority groups, we're working closely with the Rappahannock Area Health District to identify all those individuals, everybody who works for the school systems, everybody, the postal service workers, all those other individuals in those groupings. We're working with the health district to talk about how we're going to address those groups and make sure that they have access to the vaccine. And so that's a very coordinated effort with our Rappahannock Area Health District to talk about, okay, how are we going to make sure that those groups get access to the vaccine as well?
Thank you. Now, you had mentioned earlier that we had already started, to get out into the 1As outside of the hospital. Are we still doing those? Are we still offering 1A vaccinations as well?
Yes. So we're never going to stop a category. So, I always tell people, when it's your turn, get it as quick as possible, because we don't know when, more supply is, and the more people are invited, the longer you're going to wait, harder it's going to be for your schedule. So when it's your turn, go get it. Do not wait. Don't take that wait and see approach. But that being said, if it's March or April and we have vaccine and somebody in 1A decides they want the vaccine at that point and they didn't, we will certainly vaccinate them at that point.
So what about people who have already 2 days ago, before we knew we were going to do this, we were encouraging people to sign up on the Rappahannock Area Health District's website to get in the queue for when it was their turn. Should they stay in that queue, come into our queue, stay in both? What do we encourage people to do if they're already on a list?
Yeah, those were notification lists, right? That were going to give you more instructions when details came out. So for those individuals, I would say as you know, we're making kind of a commitment to say by 3 o'clock tomorrow, we think we're going to have some details ironed out for us to feel good about how we're going to roll this out to our community. That's the target we've set for ourselves. So when that becomes available, that information becomes available, we'll be probably talking about times and those sorts of things. I would encourage you to sign up for a time. The notification to the health district, you know, when you filled that out a couple of days ago, we didn't know the pool was going to be expanded and all these other things that are just, I mean, things are changing very, very rapidly, daily, hourly at times you know, with information about this vaccine. And so I would, you know, follow our information on our website. And if you're in one of the eligible groups, feel free to make an appointment to get your vaccine.
And that was one of the questions too. Is it better to have an appointment than try to walk into the clinic?
I think it's always certainly better to have an appointment than it is to try and walk in and get in a queue, because, you know, the same day queue, I don't know how many people we're going to be able to address or fit into the overflow or the extra capacity of the clinics. You know, that will be an unknown every single day. But if you have an appointment, it's pretty much like a reservation, and so it's very similar to a restaurant, right? If you have a reservation, you get your table. If you don't have a reservation, I don't know when you're going to get your seating, or if you're going to, based on capacities. It's very, I think the thinking of that is very similar.
Mike, isn't it also probably true when we do put appointments out there, people may see them for a limited period of time because the appointments we post are going to be based on the vaccine that we know we have on hand. So you might have to come back a couple of times to be able to schedule your appointment. But that's because we certainly don't want to schedule you and have you come and us not have vaccine.
Yeah, that's some of the complexities of our, you might think about that. We have to have a scheduling system that's tied to our inventory of vaccine. So that's our, we don't want to disappoint anybody that had a reservation that might show up and we don't have vaccine. I still imagine a scenario because things that where that might happen. I hope not, but that's why we have to make sure our planning is right. There's a lot of logistical planning that goes into operationalizing this, like Chris said, and I'm very thankful to all of our members of the team who are pitching in to make sure we do this as well as we can. And that is our commitment to the community. We're trying to do this as well as we can.
Is there a physical geographic footprint of who can get a vaccine through our clinic or the Rappahannock Area Health District, which has a very defined service area? You know, we're getting questions from somebody whose spouse and them work for us, but the spouse lives in Madison County, or you know, there's these specifics. Are those one of the things we'll have next on tomorrow night?
Well, I think my point would be that the vaccine availability in communities should be ramping up to be similar in all areas, and the vaccine that is allocated to our region is allocated to our region, and it's probably best used for individuals in our region optimally. And so there should be options closer to home in all the communities, you know what I mean? And so that would be my comment on that, is that, you know, the vaccine that is allocated to our Fredericksburg region is, I think the intentions are that it's used in our Fredericksburg region.
And that's defined as the Rappahannock Area Health District's region, correct?
Correct.
Okay, thank you. We're getting questions about patients who are actively being treated for disease, like say a cancer patient or a patient with heart disease. Should they be thinking about the vaccine?
Definitely. Those are the high risk individuals that are most at risk of developing a very severe COVID should they get it. So those are not reasons to not get the vaccine. Those, in fact, are reasons absolutely to get the vaccine.
If you're in a complicated treatment protocol of some way, please check with your doctor and make sure that your treating physicians are comfortable with you receiving the vaccine. But certainly for most individuals, yeah, you should definitely get the vaccine.
Great. Where do we administer vaccines? We've been talking about this successful clinic that we've been trying for the last couple of days. How are we doing this? Where are we doing this?
We're currently using our FIC Center, which is our conference center just on our campus here, which is a larger facility that we were able to stand up for this, and we felt we could get 1,000 to 2,000 people through that facility and still be safe from a social distancing standpoint and some of those other kind of aspects. Should things ramp up, who knows? Like Mike was saying earlier, we've had to change operations on a day-to-day basis based on the situation at hand. Things are changing rapidly. We may look for community partners for additional vaccine clinics down the road, but right now we're concentrating all our resources and efforts at the FIC Center so that we can, be most efficient in vaccinating as many people as possible in a day.
It is a good point of how much things have changed though. Like even in the past few weeks, we've had 3 location sites for administering the vaccines, one in an office building here, another one in our field hospital that we have built, another one at Stafford Hospital. And the evolution of those and what we've learned from those has all been consolidated now into the FIC Center, like Chris is describing. And we feel very comfortable with our ability for high capacity, high throughput, the facility and the way it works there. It's more optimized, but that's evolved over the past few weeks. So things have changed, but our plans are now like kind of fully concentrated at that FIC Conference Center. And like Chris has said, we've proven over the last several days our ability to get very good throughput through that facility.
Great. And you mentioned earlier that that we're partnering with the Rappahannock Area Health District. So can you talk a little about how this is a partnership and we're not the sole vaccination location in our community?
Yeah, so the Rappahannock Area Health District has plans to also vaccinate members of our community, and this is a cooperative effort to address the priority groups. And so there will be vaccination availability at the Expo Center, I believe, for some period of time. There will be outreach to individual locations of high-risk individuals, and that's already happening at nursing homes and other targeted things that are likely to happen in parallel to these efforts. But our role in coordination with the Rappahannock Area Health District is to be able to be in good communication so that everybody knows what is the availability in our region. Is it coordinated, and does it make sense for our community? And is it fair? Is it equitable? All of those things we're trying to address and make sure that we're doing it together and with one another, and not having separate things going on that aren't communicating with one another. And so that level of coordination and looking at the populations and talking about how we're addressing them, it's important. And so that's why we're working in concert with the Rappahannock Area Health District for the benefit of our community.
Great. Now, somebody who has active COVID virus, they've just been diagnosed, should they be getting the vaccine?
If you have active COVID, no. First of all, from a safety standpoint, you should be isolating for 10 days. So if you have COVID and you're not having to go to the hospital, you should be at your home isolated for 10 days so that you don't give it to somebody else. So
please do not walk into our vaccination clinic if you have active COVID. It would be irresponsible.
That's exactly right. So stay at home. There is some debate about this. The CDC has outlined that if you've had COVID, you probably have some immunity, natural immunity, for about 90 days. So it's not necessarily a rush for you to go out and get the vaccine. And there's others that may need it before you, because again, this is still a somewhat scarce resource we are rolling out. That being said, for our own hospital staff here who are at risk, it appears to be safe to get it once you've recovered. So you don't have to wait that 90 days. It's, the vaccine, getting it once your symptoms are over and you've recovered, you're beyond that 10-day isolation point, you can proceed with getting the vaccine, but it is likely you do have some underlying immunity for about 90 days.
We've also educated some of our folks that if they have recently had the monoclonal antibody therapy treatment, they should wait 90 days before a vaccine.
Yeah, that's a definitive, you should wait for 90 days. So that has been sort of outlined by public health experts. That's exactly right.
Thank you. Is there any evidence that shows people who receive the vaccine and later contract it do they get milder case? Is it similar to the flu shot where sometimes you still can get the flu, but it's not as bad? Do we even know that yet?
Yeah, so the answer is yes. So the end point in a lot of these trials was symptomatic COVID. And the reason why, once you have the vaccine, it's not like you can take your mask off, you don't have to social distance and some of those kind of things, is you may be still capable of getting a mild case of COVID. That doesn't make you sick. You could be an asymptomatic carrier of COVID even and pass it on to somebody else. These are a lot of the question marks that we will, continue to learn as we vaccinate, millions and millions of more people and as the pandemic goes on. So just because you get the vaccine doesn't mean it's impossible for you to get COVID, and you may even be able to get a subclinical or asymptomatic COVID and pass it to others. So you still need to continue to mask and social distance once you've received the vaccine.
And that actually leads to one of these questions. Once my whole family is fully vaccinated, once my parents have it, and once my aunt and uncle have it, can we get together? Is that the light at the end of the tunnel?
We got to look at the prevalence in our community, right? This is exactly because what Chris just outlined is the reason why that might not be safe, right? And somebody who has an asymptomatic case may pass it on to 3 other individuals at that meeting that get low asymptomatic cases. They go out in the community and all of a sudden they've caused the wildfire to get worse, right? And so it's why we all need to be responsible. We all need to be tracking the prevalence in our community. When we know it'll be safe to do that is when the overall prevalence of coronavirus in our community is very, very small. That's when it'll be safe to do those things. That is not today. That's not going to be next week. It's not likely to be next month. With the data that we're seeing, the positivity rates, the prevalence rates, the pressure on our hospital systems, it's not likely in the short-term future that it's safe to do that.
Yeah, that's exactly right. This is not a complete protection in a way. We really do need it's a combination of trying to get herd immunity through the vaccine, and we have to get a large number of people vaccinated for that to occur, and then get that prevalence down. It's the combination of both that's really going to be able to get us through this. And I've talked to individuals over and over, many myths about the vaccine, and some that believe it's better just to let COVID burn through our community. You're going to get herd immunity better in that regards. That is patently false. In fact, most of the pathogens over history that we've gotten to a herd immunity, everything from measles to smallpox and others, that has been done by vaccination. That was not done by letting a disease burn through communities. So herd immunity is achieved really only through vaccination.
That's right.
Thank you. Is the vaccine available for people without health insurance?
Yeah, there's
Yes.
no cost for the vaccine. So payment or anything like that should not be a barrier to anybody signing up in any way.
Great, thank you. There's a lot of questions about efficacy, safety, and side effects. So there's specific questions like, is it safe for people with high blood pressure? Is it safe for people with chronic conditions? Can we address that first?
Yes, again, as I said before, it's not only safe, it's really important that those individuals get the vaccine because, hypertension, obesity, diabetes, some very, very common conditions are what are leading to people getting catastrophic illness from COVID when they contract it. So those are the people. That's why we're prioritizing. That's why the governor made his decision today to move to the ages of 16 to 65 with pre-existing conditions such as that.
Now we're already seeing how we're at the point where we're giving the second dose to many of our associates and medical staff who have already received their first dose. What kind of side effects are common from the first dose to the second dose, either with Pfizer or Moderna?
So the side effects, again, are all part of your immune system reacting. So that second dose really kicks in the immune system. It really revs up the immune system. And why you feel ill when you get the flu or something like that is actually that cytokine response, that immune response. It's not the virus per se, it's your body's fighting it that causes the fevers, the body aches, the chills, and some of those kind of things. So this is, so some people are getting fevers and chills and some fatigue for probably limited number of hours, when they get that second dose, especially. And that is more common in those under the age of 50, actually, because you have a more robust, the younger you are, the more robust your immune system is. So you really mount that immune response. So we are getting reports of a fair number of people after that second vaccine, feeling not so great the next day. But it's very limited. It should not be an obstacle to getting the vaccine. The vaccine is not giving you COVID. That's not COVID that you're feeling, the next day. It's your immune system revving up, and it shows the vaccine is working.
Great. I lost my place in my question, so I just need to look really quick. We're getting a lot of questions on that step-by-step. I think there are some people who don't always tune in at the very beginning, and we explained that we were going to update our website. So if we could go back to that, the step-by-step, how do I go about getting that vaccine?
Yeah, so with the broadened groups that the governor announced today, right? The expansion to individuals 65 and older, the expansion to individuals age 16 to 64 with pre-existing conditions that raise their risk. That's just hours old, and so we need to work with our logistical team and planning team on a process of how we do that for our community. We want to do it as rapidly as possible. So tomorrow at 3 p.m., check our website, mwhc.com. We will have an update there as to where we stand as of 3 p.m. tomorrow. But we want to have that availability to those new members of the priority groups and all the other priority groups as quickly as possible here in our Fredericksburg region. We just need a little bit of time to make sure our systems are doing that in a way that's responsible.
Thank you. And to reiterate that with those 1B groups and 1A groups, to have a photo ID, have if you're old and older, to show your age, that you meet the 65 plus, a note from your doctor if you have a medical condition, and proof of employment for those that are frontline associates and healthcare workers.
That's correct.
Great. So if you're waiting for a COVID test, is it okay to get the vaccine? I know the answer, but go ahead. Somebody take that one.
If you're waiting for a COVID test, particularly if you're having symptoms, you should not be leaving your house. We see this over and over and over again, where somebody gets that COVID test and then they're out and about throughout the community for 3 days waiting results, and whoops, I have COVID, and they've exposed dozens and dozens of people. So yes, please, if you're waiting on a COVID test result, you should be kind of quarantined and keeping to yourself until you know that result.
Thank you. We can't say it enough. I know I'm repeating some questions, but like we said, our viewers don't always join us right at the top of the half hour there. So if I've had some other vaccine for something completely different, a flu vaccine or a tetanus shot or some kind of booster, is it safe to go ahead and get this vaccine close to having another one?
Yeah, I've seen no contraindication on the FDA review about how it time related to another vaccine. So you should be able to proceed.
Do we know if there's any medication interactions? Is there any known drug interactions between the vaccine and a medication?
There've been none reported to date.
Great. Is there a possibility that if someone is in our hospital and qualifies for the vaccine, will we begin vaccinating inpatients in our hospital?
Yeah, that is a plan that we are actually going to be starting to look at. The logistics to this is the second dose. So we will have to make sure that those individuals do get that second dose scheduled either at one of our clinics or at their primary care office. So there are, as with all of this, there's a lot of logistics to it. But we give people pneumonia vaccines and flu vaccines when they're in our hospitals if they qualify or they need one. I suspect we're going to be doing that as well. The more points that we're able to vaccinate individuals, the better. So, I suspect, in the coming weeks, it'll be available at retail pharmacies, private practice offices, and your primary care offices and others. We need to continue to expand. But right now, we're ramping up our internal clinic as fast as possible to get as many people vaccinated a day as possible.
So why is it only available here on the Mary Washington Hospital campus right now?
There's very limited supply chain kind of things and distribution through the state. So initially it was the Department of Health's It was healthcare systems and a couple national pharmacy companies that were going to work with skilled nursing facilities. So that was the whole 1A kind of categories. We're rapidly pivoting to 1B, and the hospitals are best positioned at this point to stand up processes in these coming weeks to get going. But I do suspect that the state will be pushing to other options for getting that vaccine out to category 1B.
When you come into, we've concentrated our efforts at the Fix Center for a reason, because there's a lot of logistics that go into administering a vaccine, right? You need to register, you need to get the information in the system, it needs to be reported back to the state, all of these things. You need to be able to administer it, you need to be able to observe the patients afterwards, schedule them for their second appointments. It is a process that needs to happen. And so the more points you try to do that, the harder it is to actually staff and operationalize those sites. So when we concentrated at a single point, that like we've done for now at the Fix Center, it lets us be more efficient and get the vaccine into more individuals actually in a faster way than we can with multiple distributed points at this point in time. And so it's the way for us to be most efficient. It's why we've concentrated on a single site for now.
And is the clinic prepared to respond if someone has an adverse reaction, such as anaphylaxis?
Yeah, we're right here on campus. Our emergency department is even, just right here. So if somebody does have an anaphylactic reaction, we will be able to respond. And that's why we're observing individuals. I don't know how many have been over the last week, but I did see a report last week that to date, there's only been 11 cases of anaphylaxis out of millions. So that is, again, I think we said that's noise. When you look at statistics, that is so minimal, and many things, medications, things that we do, such as penicillin, have much higher rates of allergic reaction than we're seeing with this vaccine. It is very safe.
And is the clinic itself safe for elderly and high risk people now that they're in that queue? Is it safe for them to be in that place with so many people?
Everybody should be masked in the facility. We have socially distanced lines, and queues. For those that were even doing the walk up thus far, it's a virtual queue, kind of like at a restaurant. You go and you get a text when it's time to come back. So to limit that congregation, that crowding, it is difficult, but I would say I would encourage seniors to come and get their vaccine. That is going to be the safest for them really in the long run. But we are making a lot of safety measures to make sure people are safe coming to the clinic.
Thank you. And is Mary Washington Healthcare or the health department doing any kind of outreach for those who may not have access to internet to make an appointment online or have the ability to drive themselves to the clinic?
Yeah, this is a vaccine that is not just for those in the know or for certain affluent communities. We are really ramping up our ability to reach out to all communities. As we said earlier, there's no charge for this vaccine. You don't need to have insurance. You don't need to be able to pay. We need to get this vaccine out to everybody in all of our communities, regardless of ability to pay. And we are doing some outreach at this point through churches, community centers, and others so that we can reach a broad spectrum of our community.
Thank you. There's some questions about that immunity, what kind of immunity you've built up once you've had COVID for that, potentially 90 days. And is there a difference between the Pfizer vaccine and the Moderna vaccine? Like one takes longer than the other. What are we seeing with that, with how quickly you have immunity or build that immunity?
I've started to use the term because I think it's the best way to think of it is I would consider the Pfizer and the Moderna vaccine scientifically equivalent. That's I think that's the best way to think about it. They are scientifically equivalent. The mechanism of action is very, very similar. And so I would just say, whatever vaccine is available, I would receive the vaccine is the best way to think of it.
And it's how many days after the second booster that people were seen to have built up some of that immunity?
7 days. 7 days after the second was where you've now achieved maximal immunity. And you don't really have any immunity until at least 12 days after the first. So we've just seen so many people get the vaccine and think, I'm great. You get that first, I can go out and do things. That is not the case. You don't even begin to start developing that immune response to about 12 to 14 days after the first, and you really don't have full effect until 7 days after the second vaccine.
And do we know how long that's lasting after getting the vaccine? I know that it's only been out for maybe not even a year. So how long do we think people maintain their immunity at this point?
In the studies, we know it's at least 6 months. We don't know beyond that because it hasn't been around. But 6 months for sure. I suspect it will be longer lasting, but more remains to be seen as this goes forward.
Time will tell. This virus has been around only a year, right? And so, but the immune response in the human body is complicated. It's not just antibodies. There's priming of T cells and other things so that when something comes in again, they're quickly recognized to produce antibodies again in a rapid fashion to keep you from getting sick. And so it's not just antibodies and those sort of things. So even the measurement of antibodies doesn't talk about really the immunity you might have by priming your T cells and other things. And so it's complicated. We've only been measuring the response for about a 6-month period. And so we'll know more as time goes on as to how long it lasts, but it certainly looks from the studies that are done in the data, it's very effective. These vaccines are very, very effective, and they are an important part of our way out in a return to some sense of normalcy.
Do we anticipate that we're going to have vaccine clinics throughout the community, or will we see that most people are going to have to come to the Fredericksburg city to get those vaccines?
I think over time, there will be an expansion of the sites of administration. Like over time, that is the plan as the vaccine becomes more readily available and it can be distributed in that way. It's hard to predict the future. Things are changing very, very rapidly here, even in a matter of hours. A couple of hours ago, our plans are different now than what they were a few hours ago. And so things are changing rapidly. I do imagine there will be a point in time when the vaccine is available in many different various administration sites.
Thank you. And do we have enough? That's coming up a lot. Are there enough vaccines already in our community for 1A and B? And will there be enough for the second shot?
I don't think we have enough for 1B now. Like they just expanded a population that I think the governor in his own words said now encompasses half of Virginians, right? And so that's over 4 million people, and there aren't 4 million vaccines available in the Commonwealth of Virginia today. So I think the honest answer to that is no, but there's more vaccine becoming available each week. That a portion of that will be coming into our community, and we'll be able to do it through our clinic. And everybody's hopeful that the vaccine availability will increase over time, and that we're able to get everybody who's eligible for the vaccine an opportunity to get the vaccine as quickly as possible. We're all motivated to do that. We want to do it as rapidly as anybody.
And will we have that second shot for everybody who gets the first shot?
Yeah, as of right now, it's a vaccine course. So we have your second dose reserved. We have heard some rumblings through the upcoming presidential administration that may change, that they may be just trying to get those first doses out as fast as possible and put pressure to manufacture second doses. But as of today, we do have the second doses available for everybody, and they are reserved for you. But that's something that could change, from either the federal or the state level.
We're getting a lot of questions about a possibility of a drive-up clinic versus a come-inside clinic. Do you think that's something that could be on the radar?
I think it's new. This vaccine is new, and there's an observation period recommended after receiving the vaccine. So it's very difficult to do that in a drive-up environment. And so, maybe as we get more knowledge and experience with that over the coming months, and we know more about it, the recommendations might change from the CDC and others that have approved these. But for now, they do recommend some period of observation afterwards, and that's best accomplished in an environment where you can be observed. It
is much easier. Yeah, much easier. The flu vax, I think people think of the flu vax and they don't realize that this is technically a much more difficult vaccine in many different ways. First, we have to ensure you're in one of these categories. There's a scheduling you for your second dose. There's the 15-minute observation. And again, these vaccines are very difficult to handle from a technical basis. They have to be kept at very low temperatures, thawed over a period of time. The Pfizer vaccine does require some dilution component. So it's a little bit more technically difficult than other vaccines that the public may be familiar with.
Can people choose which one they receive?
No. We're just giving, and as Mike said, there's no difference between them. Scientifically they're equivalent. So it's what we have is what we're administering.
So why has the governor moved forward with 1B when we still have some 1As who haven't had an opportunity to get their vaccine yet?
Well, 1As can as well. That's why I said don't wait. We do not have 4 million doses in the Commonwealth for vaccines. So when it's your turn, take advantage of it because you could end up waiting down the road. But we are still giving 1A vaccine. These prioritization lists, they really just ensure vaccine sits in freezer and doesn't get in individuals, protecting our community. If we had to wait for every last 1A before we could start vaccinating 75-year-olds, that's just a way to ensure that we're sitting on a stockpile of vaccine and we're not getting it out to people. So I completely agree with this broader group. It is the group that's at most at risk. So it's many essential workers, and it's also those over the age of 65 and with pre-existing conditions who are, really at risk of getting severe disease. It's the right call. People will need to be patient. I wish we could vaccinate everybody next week, but that's not going to be the case. It is going to take several weeks, but we're going to do it as quickly as we can get that vaccine. We're going to get it in individuals.
Do we see this as a potential vaccine that might be an annual vaccine?
We don't know at this point. As we said, this may be something you need an annual vaccine, and maybe a booster every once in a while. We just don't know at this point yet.
Thank you. If somebody has recently had surgery or planning surgery, should they think about getting the vaccine at a period of time before or after their surgery?
Talk to your doctor, right? Talk to your surgeon and discuss when is the most appropriate time for you to be vaccinated. That's probably the best thing to do. Every surgery is different. And so it depends. And the best person to advise you on that would be the doctor who's helping to treat you.
Thank you. And we're getting close to the end of the hour. This is flying by because there's so many questions. Before we kind of reiterate a few of the things we said in the beginning, we did have questions about what's happening in the hospital. How are staff? What are we seeing? Do we have enough beds? Those kinds of questions that we get every week. Mm-hmm. So Eileen, can you talk to us a little bit about what is the state of our hospitals right now?
The state of our hospitals is that we're very busy, but it's not just COVID. So our census is high. But it is a mix of our COVID patients and then non-COVID. So we've got 80 COVID patients, between 80 and 90 for the past couple of weeks. Between our two hospitals, we have close to 500 patients. So that gives you a little bit of a context of how many of our total patients are actually COVID patients. But we're busy. And our ICUs are busy. We've got very sick patients that are in the hospital. Again, a portion of those are COVID. So our staff is busy, very busy and very tired. They're working very long hours. They've been tireless through since the beginning of the pandemic, but they are here and we are very grateful for everything that they are doing every day to take care of our community. And so we are continuing to do the things we do to try to keep everybody safe. So we've limited visitation. So as hard as that is for family members to have loved ones that are in the hospital, we don't like it either. As a nurse, I know what's always most important to someone who's very sick is to have their loved ones with them, to advocate for them, to be there for them, to comfort. They're a part of their healing team. But we know that we need to limit the people, a number of different people that are in our buildings. So we're limiting visitation. So the things that we've been doing, we'll continue to do, but we are busy. And our staff is tireless in helping take care of our community.
And speaking of our staff, we ask our staff to role model the behavior that we're asking of our viewers tonight. And some of our viewers have said sometimes I see some of your staff not role modeling that behavior when they're outside of work. Can we address that?
I could say we encourage every one of our teammates to know that they are role models for health in our community, right? And when they're here in our facilities, we peer check one another every moment of every day to make sure everybody is following all the right protocols, that we're wearing PPE appropriately, wearing our masks and all those sort of things. When you're in our environments, that is under our control, and we peer check one another to make sure that's happening. When people go home to their own individual lives, it's hard to police them, but we certainly do encourage all of our healthcare workers that are part of our Mary Washington healthcare team to realize that they are looked to as healthcare leaders in our community, and people do see them out in the community. And we hope, and I know most of our healthcare workers are modeling those behaviors in their individual lives as well. And I'm thankful for that. And I know that most of our team takes that responsibility very seriously in our community.
Thank you. So as we get close here to the end, we're at the 10-minute mark. This is where we would normally have a closing. I'd like to reiterate some of the things we've talked about. There's still tons of questions. How do I sign up? How do I sign up? So remind everyone, if you don't mind, Dr. McDermott, what our plan is to get everybody to understand what it takes to get a vaccine.
So a few hours ago, the governor announced an expansion of the 1B priority group. And now that phase 1B, it used to be individuals age 75 and above. Now that age has been reduced to individuals 65 and above. In addition, he has added other individuals age 16 to 64 who have high risk medical conditions as defined by the CDC list. And so that's a new addition to the 1B group as well. So there is increased eligibility for vaccine in the 1B group in the Commonwealth of Virginia. The frontline essential workers that you see listed as well are still in 1B, and we're working closely with the Rappahannock Area Health District to identify those populations and get those populations vaccinated as well. So this is a broad group. In the governor's own words, this encompasses half of the citizens of the Commonwealth of Virginia is his estimate. And that's good news, right? Because now there are more individuals eligible. So we have some vaccine available in our community. This plan, the new expansion of phase 1B is literally just hours old. And so we need a little bit of time to work with our team to make sure how are we going to address this new 1B population here for our community? And so what we're announcing tonight is that by 3 p.m. tomorrow, we plan to have some additional information on our website, marywashingtonhealthcare.com, at 3 p.m. tomorrow. I don't know if that will be the availability to sign up for an appointment if you're in one of these groups or not, but there will be more information at 3 p.m. tomorrow for our community to know where we stand and when that availability will happen. So we're very, very excited about these the expanded 1B priority grouping. We think it's fantastic news. We stood up our vaccine clinic at the Fix Center that has the greater capacity than we've ever had before. We're excited about operationalizing that for our community and getting as many members of our community vaccinated as we can that are inside of these priority groups.
Great. So I'd like to go around the horn for some closing remarks as we close up this week's exciting town hall with great news for our community. Eileen, I'd like to talk with you first. Closing remarks on what our community can do to stay vigilant.
I think the vigilance is that you wear a mask, that you socially distance, and you pay really close attention to hand hygiene. And whether that's right now because you haven't gotten your vaccine yet, or right after you get your first dose of your vaccine, or right after you get your second dose of the vaccine, nothing changes with masking, with social distancing, with good hand hygiene. What will allow us to take our masks off is when we see a very small prevalence in our community. So it's coming, but it's nowhere close to being here yet. So don't get rid of your mask. Don't stop social distancing. Those are things that are still critically important. It's those things plus the vaccine that's going to get us back to some level of normalcy.
And Dr. Newman, I want to add that we are getting tons of love on our comments tonight. Thanking you all on our panelists for our transparent leadership, our continued information sharing, and how wonderful our associates are. Do you have any shout outs to the people behind the scenes that are helping to make this all so successful?
Again, at this point, my shout out is to everybody that stood up this vaccine clinic so rapidly. It may not, for those not in the know, may not sound that complicated, but it's an extremely complicated operation. There are IT components, and our IT department has just been fantastic. Communication department, your team leads are really getting the information out to the community, getting people scheduled. Xavier Richardson and his outreach, our alliance, getting all the private practices, in our community, and all the healthcare workers really communicated with, bringing them in to get vaccinated, and all our individuals who operationalize this vaccine clinic, volunteering, coming in before their shift. You have to remember, we are absolutely stressed. People are working so hard already, and even still, I saw, when I received my vaccine, it was a nurse who was there in the morning at 6 a.m. prior to her shift coming up, that for a couple hours was administering vaccines because she feels so strongly about it. So there's just so many people with this vaccine effort. I'm so proud of the organization. It really is a feel-good moment, is how our community, the Department of Health, everybody is stepping up to really serve our community, and I'm proud of everybody involved.
Thank you. And Dr. McDermott, final words that you'd like to send any message to our community as we close out tonight.
Yeah, I'm going to stick with we have an amazing team, right? And it takes a team effort to do all the things that we're doing. And it is a period of extraordinary stress for us as a health system. It's also a period of extraordinary inspiration for us as a health system. I want to talk about one other team that's doing amazing work for our community. We've talked about this before, the monoclonal antibodies that are available, right? It's a very difficult thing to operationalize here, but we have a team of individuals here at Mary Washington Healthcare that have done a better job of operationalizing that than anywhere else in the state of Virginia. We've administered more of the monoclonal antibodies than any other site in the state of Virginia. And our Vice President of Medical Affairs, Dr. Mandel, has run the math on it, and he estimates we may have prevented 30 admissions to the hospital because of the efforts of those teams. That is extraordinary, right? And it takes people focused on getting the task done, making it happen, but it has a direct impact. And if we've avoided 30 admissions by being able to administer those monoclonal antibodies to high-risk individuals, what a tremendous reward, not only for that team, but really for our whole community. So thank you to the infusion team out there doing that hard work with the monoclonal antibodies. It has not been easy, but it's making a difference for our community.
Excellent. So I'd like to do some closings out tonight. We know people are still not feeling well. We know there are people out there who could be sick with COVID as they wait for this vaccine. So if you are having symptoms or not feeling well and unsure of where to go and seek treatment, our HealthLink Nurse Triage line is here for you. You can reach them 540-741-1000, and they are open 6 a.m. to midnight every day. Great group of nurses there to offer you some care advice. And remember that the Rappahannock Area Health District is still hosting free testing. Take advantage of their free testing by visiting their website listed here on the screen. We will be hosting a town hall next Thursday at 6:30. So tune in again. We will definitely have more information next Thursday about how you can register for a vaccine. And as we continue through the season into the winter months, please stay healthy, socially distance, wear your mask, and wash your hands. And we hope to see you next week. Have a good night.